Infectious disease specialist Dr. Zain Chagla joins us with a COVID-19 update. Good morning and happy Friday. How are you?
Happy Friday, Bob. Good morning.
Good morning. Your name came up in our conversation earlier this week with Niagara Falls Mayor Jim Diodati, who quoted you as saying that travel is no more risky than other public activities. Do these travel restrictions that we have, do they need to be completely gone?
Yeah, I think the Niagara Falls mayor was especially mad at the land border, where, again, I don't quite understand the point of testing people who are coming in over the border in their own cars for COVID, recognizing that the second they hit Niagara Falls, they can go to restaurant, bar, gym, and acquire COVID there just as easily as they would in
Right,
Buffalo or Niagara Falls on the other side.
right.
And I think, again, the use of rapid testing on planes, we really do have to question their use. We have controls, we have masking. Are we really trying to use, excess testing to find that needle in a haystack of someone that's asymptomatic but positive on a plane? Or are we going to accept there's going to be risk and people have to, as they are in their day-to-day lives in Ontario, just accepting that risk and taking the precautions at that point?
Yeah. Speaking of masks, Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, he feels the worst is behind us. He said the mask mandate will likely drop at the end of this month. How are you feeling? Are you comfortable with that?
Yeah, look, again, this is not that people need to take off their masks, but they have the option now, right? And
Right.
and that's really the big thing. This is not going to be a legal requirement to wear a mask. No one is going to go about saying don't wear a mask, and no one should be saying that. No one is going to go about and saying do wear a mask. But it's going to be recommended in most of those settings, especially for people that are vulnerable. But at the same time, again, are we at the point where we don't have to legislate that activity? We can allow people to make their own risk assessments into environments, their vaccine status, et cetera. I think there is something to be said there when things are stable to bringing these things down. Doesn't mean it's going to be the end of things, but,
Right.
again, if we get a new variant, if we get something else happening, we use these soft measures like masking at that time when it's needed as compared to all the time as there has to be an expiry date to all of this.
It seems to be a collective feeling that we're transitioning into an endemic phase and just living, for better or worse, just living with this thing. And as you say, making individual choices as far as measures here. But would you say that's where we're at right now?
Yeah, look, a lot of people have gotten vaccinated. A lot of people have gotten COVID. We have therapeutics, we have vaccines, we have ways to make this a disease that just happens in the community and doesn't necessarily cause healthcare stress. There's still a little bit of discomfort there because our health system's capacity is not great at baseline. But I think if we keep implementing these things appropriately, particularly, again, making sure people have access to their vaccines and those high risk people have access to therapeutics when needed, the worst of this is going to be mitigated. And again, this becomes one of those community acquired infections that stays in the community for the most part.
Yeah. Let's talk about U.S. President Joe Biden mentioned in his State of the Union address about test to treat in the U.S., where if you test positive at a pharmacy or wherever, you get your antiviral kit right there on the spot. Is this something Canada should be looking at?
Yeah, absolutely. Look, not everyone is going to need treatment, right? A triple vaccinated 18-year-old is probably not going to require treatment as the risk of severe complications is low. But we need redundancy in the system to reach those high risk people. We've been doing therapeutics at St. Joe's for now 3 months. It's been going great, but there are people we miss. And really creating more points of entry in primary care, in pharmacies, in healthcare and hospitals. Make sure, again, those vulnerable people who have immune suppressing conditions, who have multiple comorbidities, who are unvaccinated, have access to something that's easy and ready to get. And
Yeah.
knowing that these medications need 5 to 7 days, there's a very short time window. Having more entry points is going to be more beneficial for people as compared to only, limited entry points where we're going to miss people that could have been prevented.
Okay, 30 seconds left. Sorry, it's such a time crunch here, but as it's agreed that we're on the tail end of this thing, what are the biggest lessons learned, and how important is it to find out the origins of COVID-19?
Yeah, obviously, especially if it is a zoonotic origin, what we can do to prevent this. And I think again, the coordination is the biggest lesson learned. We can get through another pandemic if we can coordinate appropriately and resource appropriately. But first and foremost, those lessons have to be entrenched, and those investments into pandemic planning are definitely warranted for the future, even when times are good.
Okay, we're on the tail end of this pandemic, but we still want you on weekly, Dr. Zain Chagla. Pitch us on some segments. Anyways, have a good weekend. Here's your weekend weather.